You are live.
How you guys doing? We are going live again. It's been actually quite some time, so as of right now, give me just a second. Trying to get everything going here.
You may have to silence that so it's not.
Hold on, what do I do here? Let me refresh it.
Mm-hmm.
How you guys doing? It's been a while. And
Is it pulling up on yours?
no, it's not.
Okay, go to Video Manager, I believe.
Alright,
Sorry,
guys.
you guys, we're having technical
Yeah,
difficulties.
it's my fault. I'm not the most tech savvy over here. I am not seeing it right now.
That's okay, I got you.
Alright guys, I know it's been a while since I've done a live stream. Actually it's been a little too long. I think we're a little bit past due here. So, figured I'd hop in here and just see what you guys had questions on, you know, see if I could help you with anything, see what's going on in your lives, and let's go.
So somebody is asking, Kevin Daly is asking, how do you feel about doctors of osteopathic medicine, also known as DOs?
Honestly, it's very similar to a chiropractic degree. Only difference is technically they can prescribe medications, whereas in the chiropractic realm we are kind of, I wouldn't say against it, but opposite. Our philosophy is, is based off of off the nerves, and we're gonna make our adjustments to remove pressure off the nerves. And with the DO, they're a little bit different with their techniques. Some are good, some are mediocre. I'll tell you right now, with chiropractic, we actually adjust and see many more patients than a DO. So I always recommend chiropractic over DO, but trust me, still very brilliant doctors as well.
So somebody's asking, how did you get into chiropractic?
So actually it was years ago, and I was a nurse assistant back in the day, and I was working on a med-surg floor. And to be honest, a lot of my patients, so if you're unfamiliar with a med-surg floor, it was a floor where we had like patients pre and post-op, like open heart surgeries, or kind of like below the knee or above the knee amputation. And a lot of the issues, a lot of the surgeries that the patients were undergoing were due to lifestyle factors. And if somebody could have changed their whatever was going on in their life years before, they may not have ever been in that situation. So for me, when I knew that I wanted to further my education, further myself, I wanted to be able to reach people at a point in their time that can actually really impact and really literally make a very big impact in their life. So I ended up with the chiropractic route.
Somebody, Phil Rivera is asking, do we accept Horizon Insurance?
I do not actually accept any insurance. However, I do take HSA or FSA payments. I know in my area in South Carolina, there's a lot of big corporations that do offer, like the flex spending account or the health savings account, and so I'll do that. When it comes to insurances, to be honest, a lot of the times I've worked at other offices where you go to see patients, you go to treat patients, you go to bill insurance, and then insurance comes back and says, you know what, we didn't deem it medically necessary and we're not going to pay you anything. So then what do? Then do I go back and look at the patient and say, hey, you now owe me for X, Y, and Z of the exam? So I don't even waste the time, I don't even waste the headache. It's cash credit or with the, health savings or flex spending account.
Alright, so somebody has a butt crack that's crooked, and she thinks she has a torqued pelvis.
Okay.
Can chiropractic fix this?
With the pelvis, yeah, if the pelvis is torqued, and a lot of the times when you see the deviation, literally, like when you're looking at someone from behind and you're seeing literally the butt crack, you can see a deviation if it's going to the left or to the right, and it can be an imbalance in the hips, the pelvis, the sacrum, different issues. Because if something is pulling or rotated, you'll see it obviously on the surface on the body. That's why you see when I have a patient lay face down and I scan up the entire body, those are little things that that I'm looking at.
Azelinsky is asking, what should I do for neck pain?
what should you do for neck pain?
Come see you.
Yeah, well, yes, definitely. If you can, come and see me. I mean, there's a whole array of things. It's a little bit broad of a question, depending on, is it something that just happened? Is it acute injury? Is it chronic? Is it something done after, a certain event or a surgery? Or, there's a lot of different factors with that. I mean, granted, your normal, ice or heat, stretching, PT, chiropractic care, those are all multiple avenues where you can go with neck pain. But just kind of, if you re-ask that question a little bit more specific, I'll be able to answer that better for you.
Okay, is the Y-strap recommended for everyone?
Now, technically, yes and no on that one. The reason I say that, yes, on the fact that over time, obviously, people of anywhere, any kind, always have pressure getting built up on their spine, on their nerves, and that decompression, I mean, it's a powerful move. It just removes that pressure off those nerves, which is what most people need, that built up of pressure. And then obviously, you guys watch the videos, you see the reactions with that Y-strap and that decompression, and people are like, holy cow, they didn't realize how bad they needed it. Now, the reason that I said yes and no is because the issue with some patients, if they have like a fusion, those are a little tricky, because when you go to do a little bit more powerful of a technique, if something was to happen, if I was to do the Y-strap and a screw or something in the fusion broke or did something like that, then obviously I would be held, accountable on that aspect. So it's a slippery slope with that one.
William Cotton, could my dizziness and nausea be caused by my neck needing to be cracked?
Well, I would not really call it neck needed to be cracked, but the dizziness can be caused from pressure on the nerve. When there's pressure on a nerve, especially in that upper cervical area, it can cause, like a vertigo or a tinnitus, any kind of like ringing in the ears. Things like that can be caused by pressure on the nerves.
Chris Parker is asking, tell me how you feel about Gregory Johnson and his technique.
Honestly, it's still also another very powerful technique. Couple things that I'm not the biggest fan of. I don't like the fact of locking people in at the hips. As you can tell, if you pull, and granted, you guys see me pull on the Y-strap, and some patients, I give a pretty darn good tug. If I pull too hard, they slide up off the table. If he pulls too hard, there's only so much give, where once it goes so far, then you're gonna start tearing things on that aspect. Now, granted, he's not gonna do anything that's gonna really hurt you. It may be some soreness for a few days after, whereas the difference in his technique to my technique, you see my patients instantly standing up, talking, in a ton of relief, where his patients are usually not talking. Or, there's a video that was brought to my attention of somebody that was kind of screaming and crying and saying, please, no more, and stop, no more. But it is what it is. So, both a good technique, but one's a little bit more aggressive than the other.
Where did you go to school?
I went to school at Life University, which is in Marietta, Georgia. So, a little bit like right outside of Atlanta.
If the adjustment routine is the same, why the exam, considering that there's no effect on the treatment routine?
So, in reality, when I'm going through and doing the exams and doing the adjustments, sometimes some of the adjustments are done at certain levels, meaning I'll make an adjustment and either T1, T2, T3, or even down to T4, like that first one where you guys see where I start off. Now, granted, on one person I'll do a T3, and someone else I'll do a T2. You'll see some patients when I have them sit up on the table, I have them straddle the table, one leg on either side. I may only rotate and do an adjustment on one side compared to bilaterally, or I'll have both sides done, or even a side posture technique. It might only be one side compared to the other. It's just, you gotta realize our spines between human beings are all the same. Granted, majority of the adjustments are gonna be the same. It just depends on the level and where you're making that adjustment at.
So thought before I give you another question.
Okay.
Perfect, thank you. All right, so somebody's asking, Lisa Dolgan.
Yes.
I have fibromyalgia
Yep.
and lower back arthritis and bone spurs. Would chiropractic help?
It can, yes, of course it can. I've helped a ton of patients with fibromyalgia. Absolutely terrible, and I feel awful when I have patients that come in, because I've had some with like the severe cases where literally in chronic pain and even like to the touch are in pain. The one thing looking at with the bone spurs where you want to make sure of is making sure that there's no bone spurs that are actually going, like if you're looking like in your spinal canal, you don't want any of the bone spurs actually go. I know this looks awkward on this little screen here. You don't want anything protruding in and pushing and putting any pressure on the actual spinal cord itself. So if it's an area where you've gotten an MRI done and you see that there's no pressure or there's no bone spur going in the canal, you're completely fine.
Okay, how much is a typical adjustment? You guys, prices are all on our website.
Yeah, our adjustments, so it depends on our initial exam, depending on if you are comfortable or uncomfortable in getting a video recording and getting a video up on YouTube. So I would either range $150 without a YouTube video, or it would be $75. So I take half off, and then we record the video and we post that on YouTube.
Okay, let's see, Jason Alleman. What's most effective, ring dinger, occipital lift, or Y strap?
I mean, honestly, it's preference. I guess it depends on proximity where you're at. Occipital lifts are a good move. Only issue is that you're really only getting the occiput. Now the ring dinger and the Y strap, you're getting a full body decompression. So it just depends on how you want it done and how much you want to pay. You can pay $500 in Houston, or you can pay $75 in South Carolina.
Ryan Racing. I struggle with low back pain that goes into my right hip and leg. It's stemming from a car accident. How do I find a chiropractor that can help me with more than my current chiropractor?
Now, whenever anybody asks about a chiropractor, in their area, to be honest, the Y-strap technique is not that common of a technique. Obviously, I know a lot of people have asked and probably have called around to their local chiros, but the best thing to do, and where patients will find the most relief, is calling around and looking for a doctor who does a manual cervical decompression technique. Granted, you see mine done with the Y-strap. You see in Houston it done with a towel. Now, in other terms and other ways of doing it, you can do it with your hands. You can, bring one hand on the base of the occiput, the other hand underneath the chin, and do a pull-through technique. So there are different ways of performing a manual cervical decompression technique.
Dendo FX. I have a great question. If it wasn't for chiropractic care, what would you see yourself doing?
Honestly, I don't know. I mean, from 4 years of schooling and then getting out and then practicing after that, I mean, this has been almost like the last 8 to 10 years of my life. I don't know. Before that, I was gonna go to med school. I took a MCATs and everything, and that was my goal originally. So I'm glad I went this route than going the medical route.
Kelly Peterson. I fell on ice a month ago. I had continued pain for a few weeks after that. I was referred to a chiropractor, but it hurt so much getting adjusted. Do other patients ever have issues getting adjusted?
Yes. Now, the one thing, and a lot of times when I'm emailing with a patient back and forth, I'll ask and try to find out if it is, an acute injury. A lot of the times, if somebody comes in, and like in your case, and you're in extreme pain, as a doctor, granted, yes, you can, I can still adjust you. Only issue is, it's going to be painful for you. So a lot of the times what you want to do, you want to bring that inflammation, you want to decrease it, you want to do your, if it's like your over-the-counter medication, your Advil, your, Motrin, something like that, your ibuprofen, doing that, and then obviously with a, like a cold bath, cold shower, ice pack, something to bring down that inflammation. That's going to be one of the main things first. Once like that acute phase and that pain is gone, then that's going to be the time frame to start doing the adjustments.
Let me see. Living with mild scoliosis, and can chiropractic help this, especially with the crazy neck pain? Steve Friedwald.
Yes, there's actually a ton of cases of patients with scoliosis that not only get relief but can also get correction. Now, when it comes to a little bit more extreme cases, not only are adjustments effective, but you would also want to do some sort of bracing, some sort of strengthening on one side and stretching. So there are different ways to help straighten that scoliosis out. It just depends on how the curve is and what you need to bring the spine back to back balance, back to the center.
So there's two similar questions here. Sean Ololin, I'm sorry you guys, I'm probably butchering you guys' names, and Ashley Hill. Sean asked, why don't more chiropractors do the Y-strap? And then Ashley said, I really can't wait to be able to make an appointment with you. I do have a question. Why is it some chiropractors don't do the Y-strap when it seems to help a lot better than most adjustments?
So one thing, when it comes to the Y-strap, it's not a technique that's actually taught in school. I didn't learn the technique until actually the first chiropractor that I worked for, my mentor actually, he was the one who taught me that technique. The first time he did the technique on me, I couldn't believe it, and I mean, I laid on the table for a couple minutes, and I was like, oh my gosh, I don't know, can I move? Am I good? And then you wiggle your toes, and you're like, oh my gosh, I stood up doing one of these, and I'm like, I've never felt so good. I'm like, that was such a powerful technique. That was better than anything that I've ever experienced before. Why have I never learned this or even heard of this before? And honestly, I mean, it was, the technique itself has been around for over 30 years, but it's just not highly taught or trained to chiropractors. And a lot of the times, if you try to ask your local chiro or even show them a video, they look at it and they think it's crazy because it's such a powerful move. Majority of them are almost afraid to do the technique. Now, granted, I actually have a ton of chiropractors that reach out to me asking me, where to purchase a Y-strap and asking me, on instructional videos. And, I try to do as much as I can to help people because, the technique itself is a powerful technique. And as you guys can see, my patients, they get the results that they're looking for.
Ron Wienand, how often would you say we should have the Y-strap done per year? And then Benjamin Kolk is asking, can a teenager have the Y-strap done?
Anybody, well, let me rephrase that. I guess not anybody can have the Y-strap done. I'm not gonna, strap up an infant, but there are different techniques. When as a teenager, yes, 100%. I've used the Y-strap on many teenagers before. Younger children, I'll do more of, like I was telling you, that pull through, the cupping on the occiput and using, my other hand underneath the chin, and I'll do that technique just on younger children. Besides that, my goal with all of my patients is getting them in 4 times a year, so about every 3 months, and just getting, that kind of that quarterly tune-up. Everyone, you're active, you're doing things, you're mobile, you're working out, whatever it is, you're always just active and moving. So you're always going to need a chiropractor. And granted, a lot of the times it's hard to just uplift and uproot your entire, day-to-day process and go to somebody 3 times a week for 3 months and then dropping it down to 2 times a week. I understand. I have a life as well. My patients have lives as well. So I look at it, I would rather deliver a very powerful adjustment and see you less frequently, but just be a little bit more thorough with my adjustments.
All right. Can you be too young to receive an adjustment? Little Biggs asked that.
No, not at all. I actually adjusted my son about 15 minutes into his life. So, now granted, the adjustment is completely different on an infant because there are literally no muscles in the neck and the back, so the adjustment is a lot different. But you got to realize, when giving birth, the medical doctor, their job is get the baby out alive and keep the mother alive. Those are the two goals of the medical doctor when delivering a child. Now, if you need to pull and wiggle and do whatever to get the child out, they're going to do that. So when my son, was being delivered, trust me, his little head was getting pulled and his neck was getting pulled on. So literally within 15 minutes, laid him down on his back and did a quick little adjustment and let him relax after that.
All right, so Jackie Ardeline is asking, can you please move to Naples, Florida and open shop here? Is that right?
Yes, sure. Let me uproot everything. But no, honestly, Naples is a beautiful area. I have been, so definitely love the area. But I will be staying in South Carolina. We're kind of getting our roots in and getting here. So it's a beautiful area. We're near family, and actually my family from the north is in the process of moving down south. So yeah, we'll definitely be staying within the Greenville, Spartanburg area.
Optimus, what kind of beard oil do you use?
It's been different, to be honest. Now, what is it? It's just been argan oil I'll use, to be honest. I used to get that, that Dollar Beard Club, and I used to get that oil, which wasn't bad, but I don't know, it stopped renewing my thing, and then I ran out of oil, and then I don't know, I just used the same argan oil as I put in my hair on my beard, and it works.
So I'm still seeing a lot of questions on the prices. You guys check out our website, drjosephcipriano.com. All the prices are going to be on there. We don't accept insurance for those who are asking. And if you're trying to schedule an appointment, visit our website under contact.
There you go.
All right. Kelly Peterson, can I see a chiropractor for migraines?
Yes, of course you can see a chiropractor for migraines. I have a ton of patients that come in for migraines. It can be a great relief. Now, granted, you want to make sure and find a chiropractor that you like and you're actually getting results with their techniques. Everyone is a little bit different. I'm not going to lie, when adjusting, it is a little bit of an art form. Now, granted, everyone goes through they learn your basic techniques. They'll learn, you'll learn your full spine, your diversified, your Gonstead, your Thompson, your different techniques, you'll learn them. But once you get through school and you start actually seeing patients, you start to develop your own kind of pattern, your own routine, and you'll see many chiropractors out there, they'll deliver a routine on how they examine a patient and how they choose to go ahead and make an adjustment.
So One Crazy Life is asking you if you can tell where you buy your jeans.
My jeans, babe, where did we go? Express. Yeah, majority of them are from Express that I get.
You always claim that they're extremely comfortable.
Yes. Yeah, they fit really good. They're soft, they're nice. I used to, waste money on very high-end jeans, but there's no point. Dude, Express jeans were perfect, and they're actually cheap, so it's always not a bad way to go.
So Shadow Faux, I'm just gonna read it like that. I had the Y strap done there and wanted to just say thank you.
You are very welcome.
End times profit. Hey there, can an occipital lift be done on both sides of the neck or just one?
No, you can do an occipital lift on both sides actually. Just like you can do an atlas adjustment on both sides. Yeah, you can do it both ways on it. Now, one side might actually need it more than another side, but once you make that initial adjustment on the one side and you move it into the correct place, you may not realize, but that other side may actually need it a little bit as well.
Dr. Gregory Johnson is watching your live video, and he asked, when do you plan on stopping by my office? My ring dinger ain't no joke.
No, it is not a joke at all. As of right now, probably won't be in Houston soon, but I will actually be out there. And actually, so I started my initial career in the Woodlands is where I started. I was out there for quite some time up in the Woodlands, but if I would have known at the time, and I was never on YouTube back then, but if I would have known, I definitely would have stopped in Houston and checked you out.
All right. 1 second. Let me see. A a lot of questions here. Is there an alternative for the high velocity neck adjustments and alternative for the manual decompression?
Well, I mean, there's different types of neck adjustments that can be done. There are multiple different techniques. You know, and then depending on some patients they can relax better in a supine, meaning like laying on their back face up. Some patients, you know, will lay face down. Some patients are done in a sitting position, and even sitting, some doctors will do the cervical adjustment standing in front of the patients, or some actually stand behind the patients. It depends on what the doctor is comfortable and actually what the patient is actually comfortable in. What was the other part of that question?
You know, I'm not sure. I scrolled away. I'm sorry.
It's okay.
So we have Husky, who said, I have nerve pain through my right shoulder blade. Should I see a chiropractor? I've had this for 6 to 8 months.
If you've had this for 6 to 8 months, well, a couple things I would ask first. You know, like, what was the course of treatment? What have you done originally for it? Have you just been living with it? Have you tried stretching? You know, any types of yoga, hot, cold, anything like that? If things aren't working, or massage, anything like that. 100%. I get a lot of patients that have issues between the shoulder blades. I mean, you guys see the videos. Patients, you know, they come in with pain, they come in with issues, and they leave with no issues, because when you remove that pressure off the nerve and you allow the body to heal and function, you know, then you're finding that relief that you've needed.
Bryce Holland is asking, I know you want to go to a properly trained chiropractor to help you with adjustments. However, what is something that someone can do to help their significant other to get relief by adjusting their body?
I would definitely not recommend doing home adjustments. If anyone needs adjustments, I'm telling you, going to a chiropractor and going and getting it done by a professional is what you need. Trust me, I know at home, and I even talk to a lot of patients, and people do that like self kind of cracking. They'll use their hands and they'll do whatever. The only issue, what I always tell my patients is, you know, if you go to make this self-adjustment, are you actually adjusting the segment that needs to be adjusted, or are you just randomly, you know, making a movement in your neck, and you may actually hyper extending, you know, one segment compared to another, and, you know, yeah, granted, you hear a pop or a crack, but that may not be the joint that needs a pop or a crack. So I would always recommend going to a chiropractor to get your adjustments done.
Massage is always great, though.
Oh, of course, massage always feels great.
All right, so Natalie Rodriguez said, I saw a video of yours where you adjusted someone that had TMJ. Is that something that can be adjusted in one visit? I'm tired of a clicking jaw.
It depends. Those ones are difficult. Jaw adjustments are not fun. I'll start off a lot of the times, and I do a little bit of a less forceful technique, almost just a technique where I stand behind the patient and I'll just kind of do a pulling up, and I'll try to just pull almost the jaw back into place. That's a little bit easier of a technique. Now, when you see patients, when I lay them on their side, and the table kind of pops up, I do what's called a toggle technique, and I'm doing that toggle technique right on that, you know, the TMJ, right on that joint. To be honest, that is not fun. It literally feels like I'm punching someone in the face. It is not a fun adjustment. Trust me, the patients that do get that adjustment, it's not that great either. They don't feel the best, but I always forewarn and let people know, if you need this done, of course, I will go ahead and do it, but, you know, I always just let people know.
So Love Always Angie, what is the device you use on tense muscles?
So I use the Hypervolt. It's just that handheld portable massage device. Now the reason that I use that, you know, like before or after when I see my patients is, you gotta realize our muscles are connected to the bone. You know, I just kind of like to always break things down very easily. Muscle is attached to the bone. So if the muscle, if one side is pulling very taut and tight, it's going to pull the bone in that direction. So if you can relax the muscles, relax, you know, those areas, and then make the proper adjustments, your body is more likely to hold that adjustment longer.
All right. So the Weber family, I have bulging disc in my neck with them sitting on my nerve. Would you suggest the Y strap?
Oh my gosh, yeah, without a doubt. Any type of disc bulge, any issue like that. Now, as long as it's not like, prolapsed, and where it needs surgical, like intervention, because trust me, there are certain disc bulges that, it bulges in a piece of the, the nucleus pulposa actually leaves, and then it starts traveling up and down your spinal cord. That you would 100% need surgery on. I would imagine if you're already asking me this question and knowing that you have a bulging disc, I would hope that you've had, like an MRI done, so you know like what type of stage of a bulging disc. But your, like your beginning and your intermediate stages, oh my gosh, they work phenomenal with any type of disc bulge.
So retro, oh, hold on, the phone just tweaked on me. Never mind, the question is gone.
Oh, sorry about that.
Oh, I found it. Okay, retro Robbie.
Yes.
I have early stages of
Ankylosing spondylitis.
Yep, are adjustments safe for me?
Yes, they are. To be honest, in your condition with AS, you're going to want to get adjustments like yesterday. The reason I say that is what ankylosing spondylitis is. It literally is your body, the ligaments that are starting to fuse. So your ligaments are starting to turn to bone. So you got to realize that. Your range of motion, your rotation, your lateral flexion, your, all types of lateral flexion, rotation, bending, flexion, extension, it's going to diminish. There's not a cure for AS as well. There are ways to help treat and prevent it from worsening, and chiropractic care is one of those ways. What you want to make sure and do is you want to keep motion in the joints. And once you have that motion and you keep the motion in the joints, your body will not fuse up. So one of the main things, you're stretching, exercises, working out, running, you're gonna want to stay active. When you start just getting onto a couch and not moving and being very stagnant, things will start to progress a little bit worse. Granted, with that, there's your whole dietary aspect to it, but that's above and beyond.
J Dig 1982 is asking, why is it when you see chiropractors who take x-rays, you only see before x-rays and never after?
Now, that just depends on where you go. Where I actually started my career at, we would take films every 3 months. So when a patient came in, we did a day 1, day 2 visit. We'd take the films and would see exactly what drawn all the films and see the specific angles and degrees of everything where it's at. After 3 months of care, would re-update those x-rays and then would be able to have the comparison, from one to the other. And from there, would be able to update the adjustments that a patient needs. So it just depends on the chiropractor that you go to and what they use as a, like a source of, to show and to measure, your care at.
There's a lot of people asking your location.
My location is Spartanburg, South Carolina.
Right.
So if anyone is going to South Carolina or like to, even to the coast, Myrtle Beach, Charleston, things like that, we're on the East Coast. We're probably about 3 hours off the coast. But yes, I have a lot of patients that are, even if they're like driving through, they'll try to call up and get in odd times. For us, we book up a lot quicker on like Fridays and Saturdays. Weekdays though, there are a lot of just like random open time slots that are available. So, we do always usually have an appointment or two during the week.
Starting June.
Starting June though, we will be Thursday, Friday, Saturday. So we'll only be doing those 3 days. Just because I've got a couple other things going on, which I'll get into a little bit later.
Dioneth Patrick is asking, does it help with cervical spondylosis?
Yes. Anywhere where, even like a facet arthrosis, any type of, misalignment in the neck, patients, I promise you, will get a great response. And yeah, in a any type of spondylosis, if things are shifting forward or backwards, the results, they speak for themselves. So yes, 100% I would help with that.
Sarah Diaz, as a massage therapist, I'm curious to know if the hypervolt really helps with muscle tensions before you do your adjustments. I want one, but live in Canada, so it'd be expensive.
Yes, and I've actually had quite a few patients that were massage therapists and came to the office, and I would use the hypervolt on them, and they actually couldn't believe just like how powerful that that portable device was. It really, especially on patients that are just like really extremely tight, those very tense patients. Instead of going through like a deep tissue massage and just killing your hands and your arms, because I know as a massage therapist, trust me, you know how hard and the amount of pressure you're using. Changing it up and using that device is just, it's like butter. It's like night and day difference using that thing. So it'll help, save your hands and your arms a lot.
Badit Marty is asking what shampoo you use.
Actually, what is it? Garnier Fructis.
Mm-hmm.
That has been, we've gone through many different types, but the shampoo and conditioner ended up, actually it's our favorite conditioner, so obviously we just,
super soft.
yeah, obviously we just get the shampoo to go with it.
F Soul 845 said, what is your personal relationship with physical therapists, good or bad?
I was at an office where there was a medical doctor, a chiropractor, and a physical therapist all under one roof. Honestly, chiropractors and physical therapists should be working together, not like against each other. Because you got to realize, if I can move a joint, get it realigned where it needs to be, then you send a patient off to a physical therapist. Now they can help, gain even more range of motion, just whatever joint it is. But they should be working together with the adjustments and, in the stretches, not against each other.
It works hand in hand.
It really does. Same with massage therapy. Chiropractors and massage therapists should be working hand in hand. They shouldn't be trying to fight and say, oh, well, this works better than that, or that works better than this. Because honestly, everyone is a little bit different. People may respond very well to one thing and not as much another.
Samantha Phillips, what made you want to start a YouTube channel?
Honestly, it was my sister and brother-in-law, and they were like, Joe, you deliver a great adjustment. You should, start filming your videos and showing what you do. And in the beginning, I was at the time I was working for other doctors, and you guys would see in the beginning I had fun, and I would be like different locations when we were like on vacation, and either meeting people or family, friends. It was just like random, and I would just set up the table, on a beach. We would have so much fun, and we would film on the beach, we would film in a park, we would film at places. And to be honest, I didn't know that my channel was going to take off as quickly as it did. In 1 year, literally from 0 subscribers, in 365 days later, I hit 175,000 subscribers. I'm literally now like a week over a year. So, granted, it's, to all of you guys who view my channel, and, you guys see the relief with the patients. So, thank you guys.
So Jared H. said, I have a L5-S1 herniation with sciatica. My chiropractor always seems to do the same routine, but I still have issues regularly. Any recommendations?
I do get a lot of patients that come to see me that, they go to their regular chiropractor, frequently. If it's, weekly, bi-weekly, monthly, whatever it is. And yeah, a lot of the times, chiropractor, they get into their routine. They know what the patient needs, but sometimes, like for a patient, your body is already expecting a certain movement, and that joint that actually may need to be moved doesn't really want to move anymore. So every now and then, I'll get a patient that comes in, they'll see me like one time every, like I always tell people, like every 3 to 4 months, and then little things on the regular, they'll go to their, their local chiropractor, and they'll get their, minor everyday things kind of worked out. But yeah, I get a lot of patients, even seeing me, we've had patients drive 19 hours one way just to get adjusted. So trust me, if you've never experienced a wide strap decompression, I'm telling you, it's life changing.
Max Kropman, I have really bad pain in lower right dimple of my back.
Okay.
By the sacral joint.
Yep.
It shifts and pops when I move it. Do you know what it could be?
I mean, the area where you're talking about sounds like your sacroiliac joint, your SI joint, obviously on your right side. So, yeah, it sounds as if there's some type of sacroiliac joint interference, something that's going on that's not obviously in the correct alignment. Now, between that, it could be partial. It could be a little bit off. It could be your L5, your lowest lumbar, something onto your sacrum, but it's all between the sacrum, the ilium, and like that low back altogether.
Italian mukbang Nana said, I have my left side of my neck will crack, but the right will not crack. I was told to have a shifted rib. Any idea what to do?
Well, if you have a shifted rib, a lot of times you'd need more of just a rib adjustment, or even like what I do that standing intercostal adjustment. That one will help with the thoracic spine, but it will also help put the ribs back in place. Now, when it comes to the adjusting in the neck, granted, you should not be doing the self-adjusting at home because certain things may move that don't need to be moved, or vice versa, things that may need to be moved aren't getting moved. So as you can tell, one side of your neck is moving very well, and the other side, which isn't moving, is probably the side that actually needs the adjustment.
All right, so Mark Flip is asking, what's your thoughts on Socal Chiropractic? And then Anthony asked, or Anthony Arena, have you seen Dr. Brett Jones' videos with Source Chiropractic? If so, what do you think of their techniques? It's very different than most of the chiros I've seen.
Now, I know that Socal, he's based out, Southern California, duh, the name. He is a upper cervical specific doc. And I know, trust me, there's videos of him. He does that one very powerful upper cervical move. I mean, he changes lives. Now, I've had some patients that have seen him and that have came and seen me as well. And after getting a wide strap, they couldn't believe the difference. Granted, the whole thing, really what it comes down to is how you respond to the adjustments. If your body responds positively to that chiropractor and to the adjustments, then obviously that is what your body needs. Now, the reason that I get a ton of patients coming to see me is patients see a full body adjustment and they know that they've been needing that decompression technique, and that's why people come to see me. Upper cervical docs, it's not my thing. I feel like, I can adjust multiple segments and I will, but not gonna bash it or anything, because you see the results on his page and they're great results as well. So, keep it up.
McGilla reading, why do you rarely or never have videos demonstrating adjustments or extremities, heels, elbows, shoulders, etc.?
I'll do some, but a lot of the times I'll do the adjustments, like if I do somebody's like hand or wrist or elbows, things like that, I'll do them within the entire adjustment. I started doing little segments just on like the foot adjustments, like some extremity, and then I get a lot of people, at home that are trying to, like monkey see, monkey do, and trying to learn and do it themselves. So I'm not really trying to teach people on how to adjust other people, because it takes a lot of time. I've worked on many patients, and trust me, even in school, we work on each other, and trust me, it was not fun. The amount of headaches that, that we've gotten, because, you have one person who's never adjusted a, cervical spine before, and you got your buddy doing one thing on you, then someone else wants to try something different. Trust me, you do not want to be doing adjustments, by yourself at home.
The working mom said, I love your bedside manner with those who see you. We
Thank
are
you.
from Florida and plan to travel to you. How many days are needed for evaluation and adjustments, and do you adjust children?
So I see patients, you come in, just like you see during my videos. Granted, that's the part that's filmed. I'll go over your paperwork with you. We'll find out exactly what's going on. We'll go through those orthopedic tests. We'll go through ranges of motion. We'll do the, have you lay down. We'll scan the body. We'll do, the static palpation, motion palpation. We'll use the hypervolt because I always like to relax my patients, and then I'll walk through the adjustment. So what you see on the YouTube videos, that's what you'll be getting. It's all done in one day. It's not spread out into a multiple day process. So that will be done in a day. And yes, I do adjust children. I don't like posting videos on children. I know you guys, obviously, you see the comments, and to another adult, trust me, they can take it. Obviously everyone signs, video and photo release forms, but as a child, honestly, I don't want comments about children on there, so I just don't film children at all. I still, regardless without being filmed, I still honor the $75 price for children, just so you know.
Lauren Cliver, I've had prior surgery to my back. Can I still get adjusted? I hurt so bad.
It depends on what kind of surgery. If it was just like a type of surgery where it was, discectomy, something with the disc, or something with like cleaning out the foramen, things like that, yes. But once there's metal in the back, any type of, like fusions, those are when things get a little bit more tricky, and that's when I'll email with patients and I'll have to physically see if you could send me an email showing me what's going on or what type of fusion, things like that. Those are just a little bit different.
Jessica Leonard is asking you, how old are you?
I am 31. So, born August 24th, 1987. So, I know I look young, got the baby's face, but yep, still in the 30s.
Gabe Smith, when you begin your adjustments at the neck area, you'll say something like T3 on the left and T2 on the right. How are you determining that from each patient?
So when I initially, you'll see when I start going down the body, I'll start scanning down, I'm feeling like the muscles on either side, and where I'm really feeling things pushing back out at me or just like not moving how things should, those are typically where I find, compared to one side to the other. So as you'll see, when I'm at a T4, I'm a lot kind of like more down their back doing that adjustment, where if I'm, right up at T1, it's a lot closer, my hands are a lot closer together.
Eric Vasquez, I think your practice is amazing. To prevent being so routine, what other techniques do you have?
The thing is, and I've had so many patients ask me or say, about different techniques and changing it up. The only reason that I'm not going to change it up is because you see, the one repetitive thing that you guys all see in my videos is people getting better. It's like, why change a good thing if it's already great? That's the whole thing. Granted, yes, I know for you guys at home watching these videos, they may get a little bit redundant, but the reason that I have it like that is you see patients come in, no matter what the pain is, neck pain, low back pain, shoulder pain, headaches, migraine, whatever it is, at the end of the adjustment, people are feeling better, and that's the main key of everything.
Let me see. John Thompson, do you recommend a regular spinal decompression? A fan from Scotland.
Now personally, like my wife, I probably decompress her spine once, like every other week.
Mm-hmm.
So yeah, she probably gets 2 decompression adjustments a month.
If that.
Well, no,
I'll let you know when I need it.
Yeah. Well, now, but in the beginning. So in the beginning, when she, when I first started adjusting her, yeah, they were a little bit more frequent. But yeah, now I would say, every other week, to once a month, when it comes to the decompression adjustments. And I mean, for myself, it's the same thing. Now, granted, it's a little bit more difficult because I gotta either go somewhere, find a buddy of mine, someone that I know that also does the Y strap, and I can go to them to get it done. So I unfortunately maybe get it done once a month or every other month. But yeah, I mean, it's been years that I've been getting it done, and it's the best technique out there.
James N. I've been having knee, back, hip, and shoulder pain for 4 years. My doctors think I need physical therapy, but I have tried and don't think that's the case. Should an adjustment help?
An adjustment should help. A lot of the times, even your back, your hip, your knee, a lot of that, if your hips are, rotated, it's going to literally change up your gait cycle and the way you walk and the way that you put pressure on your feet, and then That's gonna then lead up to your knees. So if you got one foot that strikes the ground first compared to another, and then you may be shifting your weight too much, and that could be causing the knee problem. Now, when the hips like that are now unbalanced, that can also cause hip pain as well. Granted, it's just gonna stem all the way up as well. So, like I always tell people, try your different avenues. If physical therapy isn't working for you, try massage, try chiropractic. If one chiropractor isn't working for you, that doesn't mean it doesn't work across the board. As you see, like someone was saying, the guy in Socal, he does upper cervical adjustment. That may work for you. If it doesn't work for you, try someone else. Try someone who does a full body technique like me. There are different styles and adjustment styles out there that patients can try. It depends on what your body responds to.
Siri Chen, I was wondering if someone has a herniated disc and pain in the lower back, do you recommend coming in to get the Y-strap done, or will that do more damage?
No, I 100% recommend it. I know I was talking about it a little bit earlier, but yeah, disc herniations, patients respond just immensely with it. It's such a powerful technique, and a lot of times you'll get up off the table and you'll wonder, why didn't you come sooner?
All right, Hugh Jessel, does chiropractic adjustment help with excessive gas and bloating?
Yes and no. There are a lot of other things that would really affect that first. Your dietary type aspects, I would go on first. I would worry about that. It could be certain foods, certain things like that could be causing issues. I would go on that route first before the chiropractic. Now, granted, if you have pressure on a nerve that's going to, just say your small intestines or your stomach or something like that, yes, that can 100% be the underlying cause of the problem. But I would say, like 9 out of 10 times when it comes to, like gas and things like that, it's going to be more of a dietary type issue.
Heather Gurin, I have a backwards S in my spine. Would a chiropractic help my back pain? I have done lower lumbar shot for pain and it's helping, but I know it's only temporary. I'm also currently going to therapy.
Yes, I would definitely be seeing a chiropractor. Granted, the shots are giving you relief, but you gotta take a step back and think, all right, so I'm getting these shots done. Is it actually changing anything structurally in my body, or is it just numbing the pain so I can get through my day or get through my month or even my year? You gotta look at, what is it really doing for me? Is it actually fixing the root cause of the problem, or is it just numbing it so you don't feel pain? So when it comes to, as you can tell, your spine is S-shaped, so you have abnormal curvature in the spine. You need to do something to bring the spine out of that abnormal curvature and bring it back straight where it needs to be. Granted, it may take more than just chiropractic adjusting. Sometimes it may take stretching or strengthening certain areas. It may even take bracing, just like teeth, where you have to brace the teeth to get, back to realigned where you want them to. Same thing may happen with the spine as well. It just depends on the curvature that you have. It depends on the age. It depends on, how long things have been there for.
Is there a weight limit? I'm a big guy. I just want to make sure it's doable.
There is no weight limit at all. I can tell you right now, especially when it comes to the Y-strap, that decompression, you could be 50 pounds or 500 pounds. It's not gonna change anything, except you're still gonna get the same relief, as anybody else would.
Jenna Marie, I've had an epidural 3 times, and ever since that spot hurts to have any pressure on it, and some days it's unbearable. What would you recommend?
Those are hard. They really are, because I even know my wife, when she was giving birth the first time, we had to get an epidural. Anyways, a whole situation, but that babe, and I remember you saying you felt that spot where they injected you for how long?
Half a year, if not more.
Half a year, if not more. Granted, I would kind of tell you this, but I've never had an epidural, done to myself. So speaking from my wife, it took 6 months to a year before she stopped feeling that spot where that epidural was. Honestly, but when it comes to that, it may be time. Granted, a decompression adjustment may also help, but you know, my wife, trust me, she got the decompression adjustments as well. But you got to realize, you know, when doing that, you're literally getting a needle put into your, you know, spinal canal, and you know, you gotta realize, you know, there's always a little bit of risk involved when doing anything like that.
So Sarah Diaz, I'm seeing a lot of chiropractors use the Graston technique. What are your thoughts on this as it pertains to congestion on the surface of the body?
Graston is a great technique. I've had it done before. Honestly, when you're done with it, I mean, you're bruised up. Like you're taking that blade and you're just scraping and you're pulling the muscle fibers off, you know, like off of one's body, and it's a powerful and painful. Trust me, it's painful too. You know, technique to get done. Now, you want to make sure that it is something that you do need. Because you don't want to just bear through all that pain and then still, you know, a week later be in pain. So I mean, it does work. Now, like I say with every other technique, you know, one technique, what may work for somebody may not work for someone else. So.
Okay, Josiah Schaffer. Hey, I have major lower back pain, mostly on the right side, and it's starting to shoot down my leg, causing sharp pain. What's going on?
There's a lot of things that could be going on. I mean, any pain shooting down, you know, your sciatic nerve, that bundle, you know, it could be coming from, you know, the lumbar vertebra, it could be coming from the sacrum, it could be an impingement from the piriformis muscle. There are multiple different ways where you can actually get that radiating pain down the leg. I would definitely recommend, you know, going in, getting an evaluation done by a chiropractor, and letting, you know, having them show you, you know, where and what specific level, you know, this is being caused from, and going from there and going by the treatment plan from them.
Lynn Marie Hardy. I was a self-adjuster for many years, but last 5 to 8 years, notice my neck and back don't crack like it used to, and I feel very compressed. Would being compressed cause joints not to crack?
Being compressed, I mean, there are a lot of things, you know, if a joint, it doesn't have the mobility like it used to, and you got to realize, you know, as being a cracking type patient, over time you may not actually be cracking the correct joint that needs to be adjusted, and it's your own body's, you know, like mechanism and telling you, like, you need to stop doing this. And yeah, you should. I'm telling you right now, that decompression technique, after getting that done, trust me, like every other patient you see that gets up and off my table, you know, literally they're like, holy cow, it's like a light bulb turned on. You would definitely respond very greatly to a Y-strap decompression technique.
Josh Nelson. I have lots of shoulder pain that flares up, especially if I sleep on my arms wrong. I don't think there's a joint pop that can fix it. So how could I start implementing a long-term solution?
Now, I trust me, I know at times one may think, you know, because your shoulder's here, your neck is here, but you got to realize that the nerves that are in your shoulder are all coming from your neck. Granted, it's not like I've evaluated you and I know exactly what's going on, because, I mean, it could be, you know, literally something just in the shoulder. It could be something with your clavicle. You know, obviously it's not like I'm evaluating you right in front of me, but I do want you to know, I've had patients that have came in that weren't able to raise their arm. Then after getting a decompression technique done, after getting that Y-strap done, literally raised their arm like this, like it was nothing, and they couldn't believe it, because what I did is one neck adjustment that could make them raise their arm again, where the problem wasn't here, but it was actually up here.
Okay. BB, does chiropractic help with indigestion, such as bloating, diarrhea, constipation, or irritable bowel syndrome?
It, like I answered before, yes, it definitely can, because you gotta look at the body as a whole, and the nerves that are going to the stomach, the small intestine, the large intestine, they're all stemming and they're all coming, you know, from the vertebral spine. So in that case, it would be in the thoracic spine that are going to be going into, those types of areas. If there is compression or any pressure on the nerves, going to the stomach or those different, organs, that can be literally causing that organ to not work as it should. So it may not be able to break down foods properly. It may, with that happening, it could cause you, gassy or bloated, things like that. Now, granted, it may just be a dietary issue, or, it could be, an allergy or an intolerance. There are a lot of times, patients will go to their medical doctor and get allergy testing done, but they don't realize that not only should you get your allergies tested, but you want to get an intolerance tested as well. Meaning, it's not, an allergy tested is like you're full blown, you're gonna react to to something. Where an intolerance, it may just be irritating the body. So in that case, it may just be making you gassy. So things like that, you could easily get tested for on that case. But you can always try on your own by cutting certain foods out of your diet for a week at a time and seeing if things like that go away or not.
BT, that you're gonna like this one. My mother is Sicilian and won't allow me to visit a chiropractor. She believes it's black magic. What should I do, Doc?
Tell her I am Sicilian as well. I've got one half of the family from Tennessee, the other half from Terracini, and she should not be afraid, especially from another Sicilian. I'm telling you, it's simple. It's not black magic at all. It's as simple as moving pressure off of the nerve and allowing the body to heal and to function, as it's intended. There's no black magic. There's no waving of the hands, magic wands, anything like that. It's strictly just moving bone and removing pressure.
Okay. Is it okay to crack your own body multiple times a day, or is it going to affect you with time?
Those old things with cracking your knuckles, it's not going to affect your knuckles like that. Now, granted, I can't speak more on self-cracking of the back, because if you start doing adjustments on your own to your neck or to your back, you could hurt yourself. But it's just something as simple as like cracking your knuckles over time. No, it's not going to cause the arthritis. Like you're an old wise sailor. Your mother would be like, "Oh, don't crack your knuckles. They're gonna get big and they're gonna get arthritic." That's not true. Okay. We'll take one last question, and then, so we've been on for an hour, so then we are gonna take off from there. Any other questions, if you send them in on this video, I will go through and, I'll try to go through and finish up as many other questions as I can, but it is getting late and I do have patients I need to see tomorrow. So I'll take one more question.
So last question is Ian Mitchell.
Okay.
I recently was diagnosed with a burst cyst in my left knee. There is fluid, so it's swollen.
Okay.
I notice when I'm walking, my left foot points out more to the left and not as straight as my right foot. So do you think that's the cause of the cyst?
Well, it depends. Was that there prior to that cyst happening? A lot of the times how you're saying, so you're saying, you've got one foot that's pointing out like this and the other one that's straight. A lot of the times that's actually how your ilium is sitting on your sacrum. So if your ilium is sitting how it needs to be, your legs will be, or your feet will be pointing straight. But if you got one ilium that's like, this is awkward. I'm trying to use my hands to show a sacrum and an ilium. Granted, there's another ilium on this side. But if something is compressed in like that, that's gonna bring that external foot flare. Or if something is compressed in, it's going to make that, pigeon toe, that internal foot flare. So it could be something stemming all the way up top. Granted, with the cyst that I'm not there, looking and examining it myself, it's just a little bit questionable. But I do want you to realize it can be something right from the sacrum and the ilium.
So I'm going to give you one more because I feel kind of bad.
All right, we're getting one more.
VLI's 808 said we never answered any of his questions. So I went back through and I saw that he asked, are you the only chiropractor that uses the Y-strap technique?
I am not the only chiropractor that uses the Y-strap technique. Now, granted, I don't know where there are others. I know that there was a guy in California, the Dr. Brett Jones. He had used it in a video. He didn't use it as I use it. He used it just for a couple vertebra, and in the video you could tell he pulled at a different angle. He wasn't as much trying to decompress the spine as much as I do. But yes, there are other doctors, in the U.S. and even in the world that use it. The only issue is trying to find them, because I get a lot of patients that, they're from a different state, and they always ask me if I know if someone uses it or not, and unfortunately I don't. So it is, I feel bad. Granted, I have had a couple chiropractors reach out to me and tell me, hey, I do use it, I'm in this state. And then if someone is in that state, I've referred people in the past, to those doctors.
So everybody's thanking you for answering their questions.
You guys are very welcome. Thank you for watching, and obviously thank you for for asking me and taking that initiative in your own in your own health. So definitely, if you have questions, trust me, you can email me. You can leave more comments on here. I always try to.
Or in the previous videos.
Or in the previous videos, completely fine. But yes, if you ever have a question, feel free, send us a message, and I'd love to at least I can tell you my educated opinion on something and point you into the right direction.
Alright, have a good night, everyone.
Alright guys, thank you for watching, and yes, like we said, if you have any other questions, just send them below. I'll try to get through and answer them. But yes, everybody, good night and have a good one.